Are there regulations that you need to consider when dealing with telemedicine? With the creation of telemedicine, a lot of things have changed. While healthcare providers used to only meet their patients face-to-face, telemedicine has allowed healthcare providers to treat patients wherever they are. Hi, I'm Markeisha, and in this video, we're going to talk about some basic telemedicine regulations. Let's get started. With the introduction of telemedicine, patients can now attend healthcare appointments that they would not have been able to attend otherwise. We are currently at a new exciting health frontier. However, telemedicine has also created some new problems that we have never dealt with. Healthcare organizations now must comply with the complicated legal regulations that have been in place to govern telemedicine services. Let's discuss some of the telemedicine regulations. Compliance is of the utmost importance. We're going to start first by looking at HIPAA's privacy and security standards. HIPAA is a federal data privacy law that sets standards for people that handle someone's protected health information, or PHI. These standards apply for in-person visits and telemedicine alike. These standards include signing a BAA with your video conferencing provider and any other telemedicine service. Having a business associate agreement, or BAA, with your service provider ensures those working with you must also comply legally with HIPAA standards. Using secure data storage and transmission channels. If you get medical information before a patient visit, you must store it safely. It needs to be secure. Because HIPAA violations can be expensive or have other consequences, staying HIPAA compliant is necessary. But HIPAA violations aren't the only thing that can affect your organization's finances. To ensure you get full reimbursement from Medicare for your electronic visits, you need to understand their billing standards. Even though telemedicine provides a lot of the same services that an in-person visit does, providers have not been compensated exactly the same for virtual visits. Especially before COVID, Medicare only reimbursed for a certain set of telehealth services. However, the pandemic has led the government to expand the services they cover online. They have also changed billing codes. So you might be asking yourself, what do healthcare providers need to do to get paid by Medicare now? You need to know what Medicare will pay for and what it won't. With the addition of new codes, there are now things you can bill for that you couldn't before. COVID-19 has changed things and created a whole new standard for reimbursement for telemedicine. Make sure you keep your eyes open for what is going to stay and what will go away once the pandemic is over. While the new codes and regulations may be hard to keep up with, getting reimbursed is essential for healthcare organizations' bottom line. There is one more law you need to know about that COVID has actually caused to be completely suspended for now. The Haight Online Pharmacy Consumer Protection Act does not allow you to prescribe any controlled substances, like opioids, through an online healthcare visit. There are a few exceptions. Because of COVID, this act is temporarily suspended. Once the pandemic is over, it will surely be enforced once again. How can you comply with this act both now and in the future? Simply prescribe medication responsibly. As a healthcare provider, whether you are in person or virtual, you are still responsible for the medication you prescribe. Think carefully before you prescribe any new medication to a patient. As soon as this act is made effective again, you will have to see a patient in person again to prescribe a controlled substance. It is important to remain compliant to the rules to protect yourself from serious legal trouble. Jotform has the telemedicine tools you need to care for your patients. They have a telemedicine toolkit that offers things like HIPAA-compliant forms, scheduling, and payment options. Following the federal regulations discussed in this video will help make your telemedicine venture a success. But additional legal regulations must be followed as you navigate this new field. By understanding the basic laws, like the three we discussed, you can help both the patients and your visit. Let's recap. HIPAA's privacy and security standards for PHI, Medicare's new telemedicine reimbursement standards, the Haight Online Pharmacy Consumer Protection Act for prescriptions. Again, I'm Markeisha, and I will see you later.